Finally, we are coming to the region of the hand. And the bones of the hand we can divide into three compartments. Carpal bones, metacarpal bones, and phalanges. When we are talking about carpal bones, what we usually do, we know the number of them. There are 8 bones. About the classification, they are short bones, exactly. And we start to enumerate them always from lateral side to medial side. To orientate yourself, lateral side is always where? Where is the thumb? Exactly, because that's the anatomical position of the hand. So starting from the side of the thumb, the first row has scaphoid bone, lunate bone, triquetral bone, and on top of it, pisiform bone. Now distal row again from lateral side, trapezium bone, trapezoid bone, capitate bone, and hamate bone, that is the hook hamate bone. Now, which bones are in great interest for us? Scaphoid, lunate, and hamate. So now, guys, what we have to know about scaphoid bone? Scaphoid bone is typical bone to fracture if you are falling down in outstretched hand, right? And that's a common place of the fracture. And what could be a problem? The problem is that this proximal end of scaphoid can lose the blood supply by the branch of the radial artery. And if any kind of structure or tissue in our body lost the blood supply, what we do expect? From very beginning it's ischemia, right?
Yes.
And then that is the death of the tissue, which we name necrosis.
Yeah.
The typical place, what we will discuss a lot in the second block, the region of the heart, which the heart is supplied with the coronary vessels.
Right.
If it is loss of blood supply or insufficient blood supply, that will be the ischemia and necrosis of the wall of the heart, tissue of the myocardium of the heart. That's what we name MI, myocardial infarction. In place of here, in case of scaphoid bone lost the blood supply, we name that moment avascular necrosis. Means no vessels anymore.
And it's in the distal area that it
It
loses
is in
that.
proximal area. So that's the question.
sorry. Okay.
Yes, because branch of that radial artery, it moves in such direction from distal side to proximal side. So that's the proximal part of the scaphoid, which is in a vascular necrosis.
Here's a question.
First, let me finish first. So you can tell me, okay, what is the problem with that kind of fracture? The problem is to identify that fracture. What usually we are doing if we want to see is fracture is happened or not? We are doing the plain X-ray, exactly, the usual X-ray to confirm the fracture. But in case of scaphoid fracture, that's difficult to see it. That's our problem. What do we have to do next? How to prove that it is a fracture of scaphoid? We will not wait for 2 weeks before our patient will undergo vascular necrosis, right? We need to make diagnosis right now. What we will do? We will palpate the anatomical snuff box. Pain in deep palpation will confirm our diagnosis. So how to find our anatomical snuff box? We have to abduct and extend the thumb. And this region in between 2 tendons over here from forearm muscles, you don't know them yet, but we will talk about that later. They will limit it for us this area, and that's the fossa here, and that's the anatomical snuff box. In the 18th century, they used it to snuff the tobacco. That is why it's named like that. Yeah, exactly. That's the movement.
Is it this one?
Absolutely.
Okay.
This one, that's anatomical snuff box. If I will, yes. This one. Absolutely. If you will palpate it deep inside and your patient will confirm tenderness and pain, that will prove the fracture of scaphoid, because scaphoid forms the floor of that structure. And in this snub box we can find which artery again?
Radial.
Radial artery. Nobody has pain there? No scaphoid fracture. Next, we'll continue with the next bone. So, lunate bone. What is a typical injury for lunate? It's not fracture anymore, it's dislocation. So again, if your patient is falling down in such position of the hand, in outstretching hand, it is possible to have anterior dislocation of the lunate bone. What could be a problem with that? The lunate bone will compress the median nerve which runs over here in carpal tunnel. So that will be the carpal tunnel syndrome. Right? Next bone, hamate bone. So guys, take a look on this area in between hook of hamate and pisiform bone. Can you see that?
Yeah.
That's the place of location of the ulnar nerve and ulnar artery. In other words speaking, if hook of hamate bone is broken, these two structures could be trapped on that region, so and compressed on that region. And we name this region Guignon Canal. Guignon Canal. G is first. Yeah, you can find all the spelling in your VRS book.
Is it G-O-N-I-O-N?
Almost. So we expect again injury of the ulnar nerve and ulnar artery. Okay? Let's continue. Our metacarpal bones. What is important about them?
Yeah, they're long bones, right?
We use them in which moment? When we are fighting with the fist, like that. Right? So, we typically expect them to be injured and fractured in box fighting, in boxing. So, how can you identify is your patient is professional or unskilled fighter?
They break the second two metacarpals.
If it is the second or third bone fractures, so he is professional one, right? If it is the fourth or fifth bone fracture, he is unskilled and professional. But to my mind, if he is professional, he's not supposed to fracture them at all, right? Yes, so, but that's what we are talking about. Where is the most common place to fracture these bones? And again, let's come back to anatomical position and let's mention that these metacarpal bones, they again long bones, but miniature long bones. Miniature because of size, but still long bones because they have same parts. They have proximal end, shaft, and distal end. Proximal end demonstrates, of which bone demonstrates base. Distal end demonstrates head, and in between them that is the body or shaft. So the fracture is usually happening on these places, between the head and shaft of the bone. That's the most typical place. And finally, first metacarpal bone. The first metacarpal bone might undergo the specific fracture which happened near the base part of that bone, and we named it Bennett's fracture.
Yes.
So that's a Bennett's fracture.